Good morning, it's Sunday morning. Going to talk to you a little bit about something called multi-center trial research. I know it's a mouthful. So I'm going to use a little analogy, I'm going to break it down, and hopefully it'll make a little more sense and give you a little insight as to what we're doing with National Shoulder and Elbow Week and why we care about it, why it matters. So last week I used my seeds as an analogy to explain what we were doing with seed grants at the American Shoulder and Elbow Surgeons Foundation. Today I'm going to use another plant analogy, and that's a tree. And this is my favorite oak tree, which is in my front yard. As you can see, at some point it got struck by lightning, but it survived. But it's got this big, beautiful trunk that is totally straight. Probably goes up about 100 feet. It's unbelievable, this huge tree. We don't have any leaves on it now, but they're coming soon. Oak trees tend to pick up their leaves a little late. Anyhow, so the analogy is this. Imagine that you're a tree farmer and your land can only support 100 trees. And most of your trees are healthy, which is great. That's what you want. Trees take a long time to grow, and you can't just uproot them out of the ground and plant a new one tomorrow. But pretend that something happens to one of those trees. And being a good farmer, you care about your trees and you want to figure out what happened and why and treat that problem if you can. But it only happened to one tree. So you have a little bit of a conundrum because you only have that one tree to go by to learn what went wrong. Now, you are a social farmer, so you have a lot of friends who are also tree farmers, and you call your buddies and you realize that they're having a similar problem, but it's only one out of every 100 of their trees too. So what you do is you decide to get together and pool your knowledge, get together 20 tree farmer buddies and see if you could figure out what the problem is and perhaps come up with some new way of treating. Well, that is essentially the idea of a multi-center trial. What a multi-center trial does is the same thing but with a medical problem. And there's some problems that we deal with that are pretty rare, but still difficult problems and things that can be quite devastating in terms of outcome for some of our solutions that we have. So for instance, my particular research focuses a lot on shoulder infections, and thankfully that's a relatively rare problem, but it's a very severe problem after shoulder replacement. Shoulder infections only tend to happen around 1 in every 100 cases. But again, we're thankful that that's the case. But in terms of studying, that's a bit of an inconvenience because I may only have one patient every year that has an infection, and it's too few for me to draw any meaningful conclusions on a broad scale to only study that one patient. So I need to talk to my colleagues around the country and see if we can pool those experiences together and pool those patients together if we're going to come up with some kind of meaningful conclusion about the causes of infection, but also new treatments for infection. So what we do is we call our friends across the country. Perhaps I have colleagues in Boston and North Carolina, Phoenix and West Palm Beach and Lexington, incidentally, many of the other cities that are doing National Shoulder Elbow Week. And what we will do is we would do a study simultaneously, but across the country with similar criteria, looking at this rare entity such as infection, and we'll create work groups together so that we can pool these rare entities and do much more powerful studies. And again, the emphasis is on the fact that we need much larger groups of patients to make meaningful conclusions and to do real quality research. And the American Shoulder and Elbow Surgeons Foundation leads the way in that category. In fact, it's one of the major reasons I'm part of the organization and excited about raising money for it, because there's a lot of research out there that isn't high quality, that needs a multi-center component to it in order to get a large enough group of patients. And this organization leads the way in creating the opportunities for those types of situations and grants, and I'm part of a few of those groups. So when you're giving money to National Shoulder Elbow Week, you'll be giving money to support high quality research such as multi-center trials. Remember the oak tree.